So the last lecture we're having on anything heart today is the constrictive pericarditis lecture. Constrictive pericarditis. So for this constrictive pericarditis, it's more of like there's inflammation of the pericardium. You know that initially there could be inflammation of the pericardium, but it will not be constricting the heart initially. But if it is there and it's progressing and it's now resulting into constriction of the heart, that's when what constrictive pericarditis has set in. Okay, so talk about this condition from the definition: causes, symptoms, diagnosis, treatment, complications, and prognosis. Right. So for constrictive pericarditis, it's like you're having a thickened. So let's just go to the definition directly. So that constrictive pericarditis is a chronic condition where the pericardium becomes thickened, scared, and fibrotic, restricting the heart's ability to expand and get filled with blood. All right. Causes: it could be due to infections, it could be due to inflammations, it could be due to trauma or injury, it could be due to surgery or radiation therapy. All right, that's surgery now is surgical complications, right? It could be due to malignancy, where there's cancer or lymphoma. All right. Then symptoms: if the heart is being constricted, the patient will complain about things like shortness of breath, they are feeling weak, that's fatigue, there's swellings in their legs or ankles, right? They'll complain about abdominal bloating. They'll complain about what? Chest pain or discomfort, right? Then diagnosis now, like um, how to confirm that there is a constrictive pericarditis. You might want to do things like what echocardiography. I'm just trying to plug my phone. I want to do things like echocardiography, cardiac catheterization, CT or MRI scans, physical examination, laboratory tests, alright? Then treatments. You might want to do things like what? Medical management, like give them diuretics so that they can urinate more, so that the fluid will be excreted more. Or anti-inflammatory medications can also do. Pericardiectomy, that's where you are doing surgical removal of the pericardium, right? Then pericardial window or fenestration can also be of a thing. Then heart failure management, you're now managing it for heart failure, because heart failure can actually result from this what? Constrictive pericarditis. Then you address the underlying causes, the thing that is causing this, right? Complications. Pericarditis could result into heart failure, arrhythmias, which is like heartbeat is not going, lobbed up like we know. It could result into cardiac tamponade. It could result in what? Pulmonary hypertension. It could result into what? A liver congestion, right? The prognosis. Prognosis is variable depending on the severity and how the treatment went, right? Then usually there's improved outcomes with surgery intervention, because this is more of like a surgical problem, right? So I think that's it for constrictive pericarditis. It's just a type of pericarditis where this one now there's compression on the heart, okay? Constrictive pericarditis from definition: causes, symptoms, diagnosis, treatment, complications, prognosis, and that's it.